Hello, amigos. This is part 2 with President Elizabeth Wise, President of Lehigh Valley Hospital-Pocono, where she is giving her time, her very busy time, to give us all our community an update of what concerns that we have about the vaccines. We have part 1 video, so please take a look at it. And this is part 2. Elizabeth, thank you. Thank you for doing this and for answering to all those questions that people have want answers for.
I just want to say thank you for having me.
No, it's always a pleasure having you, even if it's through Zoom, right? The last question that we were talking about was, about people registering, even if they're not qualified yet, so that they can get the vaccines, right? As soon as they open up.
Yes, I'm encouraging everyone to sign up now through my lvhn.org. You do not need to be a patient of ours to sign up, and you will get notified when it is your turn. And then you'll be able to go in and make an appointment to get vaccinated. And we're vaccinating either at the hospital or in our East Stroudsburg Healthcare Center, Toby Hanna Healthcare Center, or Bartonsville Healthcare Center.
Thank you. What can we do to those people that are so desperate about getting the vaccines? Because, I'm connected with the hospital, and people email me, call me, I'm desperate, I'm not getting the vaccine. What can we tell these people that are that are so anxious about it?
So if it is somebody's turn to be vaccinated and they just have not been notified, right? Because we don't know week to week how much vaccine we're getting. I would encourage people to sign up at other sites. So the CVS, Walgreens, Weiss supermarkets are all vaccinating. Usually usually after 11 p.m., they post available vaccination slots that are available. So people, can wait a little bit later and see what opens up. And the good news is that we're starting to do mass vaccination events, and we'll do several more over the next couple weeks. So I would definitely encourage people to sign up and, when your time has come, to make an appointment.
And can caregivers to elderly members of their family qualify to receive the vaccine at the same time as their loved ones? Because this is something that also happens with Hispanic communities. Families live together with different generations, and one takes care of the other. And there's a concern that when it's vaccinated and the caretaker is not eligible because it's not their turn.
That is an excellent question, and one that I frequently get asked. And unless the caregiver is eligible, based on the Pennsylvania Department of Health guidelines or recommendations, we cannot vaccinate. And that is very difficult message for me to communicate to people. But if they are in the category and they're a caregiver, then they can get vaccinated. But if not, they must continue to wait their turn.
It appears that each state has their own systems of administering their vaccines to the public. Is there a bigger plan for mass vaccinations like the ones that you've done? Do you have?
So you're right. Each state has rolled out the vaccination schedule and who is eligible to be vaccinated differently. And some of that is availability of the vaccine. Some of that has to do with the number of health systems in the state that are able to vaccinate. There are discussions at the federal and local state level about more vaccination sites, mass vaccination sites. I'm just not aware at this time today of any that are going to be available on a specific date.
Yeah, but you have plans for mass vaccinations in other locations, like the one of Pocono Raceway and the other one that you've done?
Yes, the plan is to continue to offer these as we get vaccine. The current sites that are approved are Dorney as well as Pocono Raceway.
Those two. Thank you. Now Easter is coming. So we have the big issue. Over the past year, some of the biggest spikes have been during the holidays, right? And now that we are approaching Easter, what is your recommendation for family gatherings?
So Easter's one of my favorite holidays. So happy Easter to everybody.
Happy
I like
Easter.
the
What?
Peeps candy. I eat the marshmallow candy.
Oh, really? Thank you.
Yes, I do. So I have we can't let our guard down. So what we're seeing is something called variants, which is the virus evolves and mutates. And there's several different variants that have come from other countries that are in our state and the state of Pennsylvania that are spread even quicker than the first virus that we saw. So we cannot let our guard down and must continue to do the things that I've talked about with you previously, the masking, the social distancing, the hand hygiene. I know that people want to be with their loved ones. I know, but we just can't let our guard down because we don't want to, again, see spikes, particularly for people that are need to be hospitalized.
Even with people being vaccinated, there's a possibility of getting, you know, spikes.
So there's a couple things. One is that the CDC is reviewing guidelines about if you're vaccinated and your loved one's vaccinated, can you be together, what you need to do. So that is still being worked through. But even though you've been vaccinated, you can still be a carrier of the virus. It can live in your nasal cavities, your nose. And so if you sneeze or you're talking, you can still spread the virus. And you may not even know it because you might not have any symptoms.
Well, what if the virus, now let's say that the virus is getting weaker, right? And some people say, well, if more people, I don't want to get vaccinated, but because many people have been vaccinated, I don't need to be. Is that a possibility that because the virus is getting weaker, that not everybody needs to be vaccinated?
So I don't know that the virus is getting weaker, but as the summer months come, there's less transmission, right? Because people are outside, they're doing physical activities. We need to get to at least 70 or 80% of the entire population vaccinated in order for us to even get back to some semblance of normality. And then we think that even after that, we'll have to continue to be vaccinated every year, kind of like you get a flu vaccine for a period of years until this really goes away, like you said.
Yeah. And what about the mutations? Do the vaccines cover part of the mutations, or does it help with the mutations happening?
So more studies need to be done, but initially it looks like the Pfizer and the Moderna vaccine cover most of the variants that have been identified. The J&J vaccine is still being studied, particularly with the South African variant.
And now our last, well, we're almost at the end. I know people have many questions, but hopefully you'll come back with more updates as people need them or as you want to communicate to our community as a health leader that you are. Many people think that the vaccine was created too quickly and they're afraid of the side effects. What would you tell these people? Or they say, oh, I have a low immunity, so I shouldn't get vaccinated. I hear that a lot,
Hmm.
right? What would you tell these people?
So I would say that the coronavirus vaccine has been around for over 10 years.
Huh.
So this is not new development. But this strain of the coronavirus, the vaccine was developed in a short period of time, but there were studies that were done with volunteers, right, that agreed to get vaccinated and where they monitored for a period of time and will continue to do research studies on this vaccine. So what I would say to people is getting the vaccine is safe. There are very few side effects, maybe redness in your arm where you got the vaccine. Usually the second dose, people sometimes feel chills, tiredness, a low fever, but it is safe to get vaccinated.
I've heard of many people that are vaccinated that they finally feel relief. They say, oh my, I can live my life again. I can kiss, I can hug, I can go to restaurants, right? I hear that a lot. What are the recommendations? What can we do and what can we do once we're vaccinated?
So you have to always follow your state guidelines, but one of the things that Pennsylvania Department of Health uplifted was if you wanted to travel out of the state, you still needed to do it safely, but you don't have to, when you come back in, get a COVID test or a COVID negative test. So, and we will still continue to be wearing masks for a period of time. I don't know about you. I didn't have a cold this
Me too.
winter.
You're right. Not at all.
So I didn't have the flu, not that I get that every year, but uh, so I still would encourage people to be safe, particularly as things open up.
Yeah. And what are the safe things we can do? Can we hug if we're both vaccinated with some distance? Can we? People are so eager of hugging is something that has become strange, you know?
So
Get it?
I would say that we still need to learn a little bit more about that, because even if you get the vaccine, you could still be a carrier. And remember, the vaccines are 95% effective, right? Not 100%. So you still have a 5% chance that if you got COVID, which you could, you would have less symptoms, you wouldn't be hospitalized, but you could still get it. So
Yeah.
there still needs to be caution.
Yeah, people, we have to remind people of that, right?
Yes.
And now, lately, recently, the European Union has provided like passports, vaccination passports for people so that they can travel around. Are there, and here they just get a little notice that they got vaccinated, not even with their name. Are there any plans of creating one of these passports or a similar document?
I have not heard of any national plan. I know that there are certain companies that you're able to pull up the information electronically on your phone, but there's no national effort, at least this point, to consider something like a passport.
Is there anything else that you would like to share with our community?
Well, I always want to thank our community for being not only so supportive of the hospital and our health system, but really doing the right thing during this pandemic. I know it's been tough. I know people are tired, right? I see it in their eyes, right? I can't see their face, but I see it in their eyes. But we will continue to get through this. And there is hope ahead, and here's to better days ahead. So thank you for all that you're doing.
Thank you so much. And I know that one of our Hispanic community women's, Alma Reed Smith, is creating for the hospital for all the first care workers for COVID, like donating pillows so that they can rest and they can be comfortable while they're
I
working in their.
saw them. They are absolutely beautiful. I saw a whole stack of pillows
He was
on
like,
a
what are you
bed.
doing here?
They are absolutely beautiful. We have some very creative people and wonderful seamstresses here in the county.
Yes, thank you so much for the community, for everything you do. Thank you, Elizabeth, for being, the president of Lehigh Valley Hospital-Pocono, a leader, and always there. So always giving
Thank
your
you.
face there to help people. And when we feel lost or we are confusion, there's always there. You're like a tree, like a rock, a rock. You're our rock. Thank you for being the rock in health of our community. And congratulations again for everything you've achieved in Women's Month, March. Thank you. Gracias, amigos. Cristina Luna here with all of you. Please, there are 2 videos of this interview. President Elizabeth Wise is answering to your questions. Muchas gracias. And we'll continue to do so. Gracias. Thank you, amigos. Bye.